Hi everybody, I'm Dr. Anthony Kerfasi, functional medicine practitioner and double board certified in clinical nutrition. And in today's video, we're going to be discussing leaky gut or leaky gut syndrome and autoimmune conditions and how these two things are highly interconnected and highly related. We see many patients, both in person as well as remotely, all over the world, dealing with both of these conditions simultaneously because you often have to have one before you get the other. So we're going to be discussing these two today. So if you're dealing with these issues, conditions, or know someone who is, make sure you stay tuned, like this information, share this with a loved one, family member, friend who you know is dealing with this stuff. So what is a leaky gut? A leaky gut is essentially also known as intestinal hyperpermeability. So leaky gut sounds like it is what it is. Your guts are leaking, but instead of your guts leaking, what's happening is things are leaking into your bloodstream. So we're going to explain that really quickly right here. So your digestive tract is only one cell layer thick here, okay? We're going to do a little diagram cartoon here to explain this, okay? So your digestive tract is only one cell layer thick, okay? In between these cells, you have proteins that stabilize these cells, okay? So you have proteins that stabilize the cells and keep them tight so that nothing is able to enter the bloodstream here. With a leaky gut, what happens is these proteins become weak for a variety of reasons that we'll talk about, and they open up for too long or too wide. Many different things cause this, remember? And what this happens is this causes an immune response, okay? So first thing, what enters the bloodstream? Anything that you're exposed to. We see patients all over, as I said, all over the world who can have chemical sensitivities. Maybe they work in a factory or they're near a power plant, or they're painters, or they are construction workers and they're exposed to dust or strong chemicals on a daily basis. Maybe they are eating specific foods that they're reacting to. You know, some of the common ones are gluten, dairy, grains in general, but it always varies from person to person, and this is why proper testing is crucial, which we'll talk about. So literally anything that you're exposed to, your water, you know, there's some states that have very poor water supply. This is always why I utilize myself and recommend people getting their water as clean as possible. I utilize specifically a reverse osmosis filter and then add minerals back in so that the water is clean and you get clean minerals as well, because there's so many things that you can be exposed to just from your water as well. Again, this is why we test for this stuff, and we have to take a whole picture approach and really listen to our patients and get a big understanding of their entire life and why these things have occurred. We don't want to just address the symptoms because it's not going to do anything. Then they'll keep having this condition, right? Remember, think of it as if you're driving your car and your check engine light turns on. Are you going to reach underneath the steering wheel and rip out that light, rip out the cord that goes to the check engine light? Probably not. You're probably going to either pull over the road and diagnose it and figure it out yourself if you know how to work on cars, and or you are going to take it into a mechanic, most likely, because most people, there's so many things. Cars have multiple working parts, and just an FYI, your body has many, many more working parts than a car. So it's important to really understand the why that check engine light turned on rather than just ripping out the cord, because now you could have further problems. So we don't want to just address the symptoms. We want to know why and understand the root causes and address those and resolve the issue. So what can happen? As we said, foods in general, right? Toxins, chemicals, anything that you are exposed to in your environment that can cause an immune response. A lot of things, okay? So what this does is this can enter the bloodstream. Okay? So now these cells have become opened. Now your body is now reacting to these different things in your environment. So what this does, what does this cause? This causes an immune reaction, okay? Immune reaction. Okay, so this causes an immune reaction, which is often, well, it's related to autoimmune conditions, but it's mediated by an immune marker known as an antibody or an immunoglobulin. immune globulin protein. So it's an immune protein. And this is called IgG, immunoglobulin IgG. So this is a delayed response. Okay? And the one that we're checking for is G, okay? So G, and we'll talk about others. So you have 5 types of immunoglobulins. If you're going to your allergist, your traditional doctor allergist, and you're getting a food allergy test or an allergy test, they're looking for immunoglobulin E, okay, E. This is an immediate sensitivity or an immediate allergy, an immediate reaction. Completely different than immunoglobulin G. This is a systemic, chronic, long-term exposure. So if you are reacting to foods or any chemicals, etc. in the environment, over time, this will become elevated. Okay, and you can get this, these can occur anywhere, it takes a while, but this, you know, the symptoms from these can occur from anywhere from hours to days upon the reaction to these foods or the exposure to these foods or chemicals, anything in your environment. Okay, so anything in your environment, as we said, this is why personalized testing and personalized care approach is very important for this type of condition. You're able to react to these things, they enter the bloodstream, they cause an immune reaction. Okay, now from the immune reaction, your body now starts producing immunoglobulins. The first one they might produce is, well, we won't get into the specific types, but you can produce both IgG and IgA. Okay, and we test for both of these on our patients to identify this stuff. What happens though, the problem is, and that we're going to use one thing as an example here today because there's so many different examples, but we'll use one of the most common ones. And that is a food, and that is gluten. Alright, gluten is a protein that's found in many foods, but specifically foods that contain wheat, rye, and barley. However, there's many cross-reactivity foods that can have gluten as well, and there's many different types of gluten subproteins and subtypes and all of that good stuff, which we have other videos related to and discuss on our website and on our page. Okay, but what happens with gluten is you start reacting to it, okay, from a leaky gut, start reacting to gluten. Now what happens is you can develop an autoimmune condition. That's what we're talking about today, right? I'm going to erase this so we have a little bit more room here. Alright, and this autoimmune condition is known as Hashimoto's. So Hashimoto's thyroiditis, this is an autoimmune condition to the thyroid. Many people have it, specifically women nowadays. Majority, at least probably 90% of all thyroid cases are Hashimoto's or autoimmune in nature, and Hashimoto's is the most common autoimmune condition in the United States. Some of the other really major common ones that we see are things like rheumatoid arthritis, celiac, Crohn's, ulcerative colitis, lupus, but there are over 100 known autoimmune conditions. Over 50 million Americans also suffer from autoimmune conditions. So it's not something that's uncommon. It's becoming more and more common every single day. So one of the most common things that occur though is gluten. Someone reacts to gluten. Now what happens is they develop an immune reaction or immune response mediated by this stuff. Remember, an autoimmune condition is essentially the body has now developed such a high immune response that it's now making mistakes and it can start attacking its own body tissue. So it's lost the tolerance or the ability to regulate what's between itself and non-self. So it starts making mistakes. Okay? So this is known as molecular mimicry. Okay? So we're going to write that here. Molecular mimicry. So what happens now is your body starts reacting to gluten. It forms in a high enough immune response. But the problem is that gluten proteins look a lot like the proteins in your thyroid. So now the immune response is so high that it sees both gluten and it sees the thyroid proteins and it starts attacking your thyroid gland and damaging the thyroid gland. So now you've developed an autoimmune condition to your thyroid gland, and this is Hashimoto's. Alright? So really important here. Really important point. This is all mediated by molecular mimicry. So they look alike, but they're not the same. The immune system is making a mistake. So let's recap, okay? Because I know we went over a lot here today. Leaky gut, what happens is different things in your environment start entering the bloodstream. Okay, remember, leaky gut, you can think of it as if you leave your screen door open on a hot summer day and you have holes in the screen door, stuff starts entering the house, or in this case, your body, your bloodstream that you don't want there. So leaky gut, these things enter the bloodstream. What this causes is an immune reaction or immune response. What this does is it stimulates immunoglobulins to become overactive. Now the immune response is highly elevated, okay? Now what happens is it starts making mistakes, and this can lead to autoimmune conditions. For example, as we said, one of the most common ones is gluten. So your body starts reacting to gluten, which can cause a leaky gut, and also be the result of, this is why we do the proper testing for our patients, it's really crucial. We're able to test for leaky gut, food sensitivities, as well as the autoimmune condition that the patient may present with. Okay, so gluten enters the bloodstreams, creates such a strong immune reaction. And this is, gluten, remember, there's a lot of people who have celiac, but one of the most common things besides celiac is a non-celiac gluten sensitivity. And you can get a variety of symptoms from this. So many different symptoms that people get, from fatigue to skin rashes to headaches to digestive issues. I mean, there's so many. Vertigo. Okay, so now you've created such a strong enough response from gluten that now you have molecular mimicry. The body starts making a mistake, starts attacking your thyroid gland, and now you have an autoimmune condition. So I hope this video made sense. I know we discussed a lot here, but this is the bottom line. This is why this stuff is so crucial to look for, to address, and to really get to the root cause of. Okay, too many people have autoimmune conditions, and we see them all the time, both remotely and in person, and what they're getting is they're definitely not getting tested for this stuff, and they're not looking at the underlying causes. They're getting, the most common things are steroids and immunosuppressants. But remember, if you suppress the immune system, now you're not even going to be, you're setting yourself up for a lot of other things. It's a whole nother topic. So I hope this video helped you. Again, I'm Dr. Anthony Crafasi. If you are dealing with these issues or know someone who is, make sure you share this information with them, like this information. If you'd like to work with me, either in person or remotely, our information is below, so you can get a hold of us that way and give us a contact. So again, I'm Dr. Anthony Crafasi. Thank you so much for watching. I hope this video helped you, and have a great day.